Welcome to Solo, the single person's guide to a remarkable life. Your host, a behavioral scientist and bachelor, talks to leading experts and successful singles about living solo and living well. Travel more, make things, sleep in when you want to. Here's the playbook for the person who is unapologetically unattached. Now, please welcome Dr. Peter Mcgraw.
In this episode, my co-host and I speak to a urologist. We learn why a urologist isn't just for men. We discuss the nonlinear effects of testosterone, why you shouldn't get a vasectomy if you're considering freezing your sperm, and what to do if you or a partner has a crooked penis. In the bonus episode, I tell a fun story about my casting call for a Cialis commercial. Welcome to Solo, the single person's guide to a remarkable life. I'm Peter Mcgraw. Today's guest is Dr. Steven Seigel. Steven is a board-certified urologist. He graduated with honors from Duke and received his medical degree from Vanderbilt. Before moving to Boulder, he was in private practice in Georgia and Connecticut, and he's currently living the solo life while he waits for his family to join him here. Welcome, Steven.
Thank you. Thanks for having me.
We're joined by a special guest co-host today, Kim Terabiel. Kim is a writer, Reiki practitioner, and a certified yoga teacher. She's a graduate of the University of Hawaii with a degree in English literature. She's 36, or as she likes to say, 30 sex. She's single, lives in Boulder, Colorado with her 2 dogs. Welcome, Kim, and thanks for helping out today.
Hi, Peter. Thanks for having me.
Kim, do you want to start with a question?
Oh my gosh.
I have questions, but I didn't know if you had one that you were dying to ask.
Okay. Thank you for putting me on the spot. So we're here. So I had questions about vasectomy. Should I just jump right into that? I didn't have questions about anything else.
So we might not hear from Kim for a few minutes until we get to the vasectomy stuff. So Steven, what does a urologist do?
I guess at the heart of it, a urologist does anything that has to do with the urinary tract.
Okay. So that means it's not men only. You have female.
Correct. Yeah, no, I think probably 30 to 40% of our patients are female.
Okay. See, there you go.
I had no idea.
See, we've already learned something today.
Yeah, no, a lot of people think that we're sort of like the male version of a gynecologist.
That was one of my questions.
Yeah.
What was the question?
It was, do most men have a urologist? Like most women have a gynecologist. Is it just someone you see on the regular, or is it a special occasion trip?
I think most men do anything they can to avoid seeing a urologist. But I also think that men in general are not trained to go to the doctor. Women have it a lot rougher. In the list of medical woes, the women are so far ahead of us. So most guys have avoided going to the doctors all these years, while the women start getting embarrassing exams from a young age, So, most men do not have a urologist. Most men end up with urologists when they're older, but not in the under 50 range for sure.
So, in full disclosure, I met Steven because I went for the first time in my life to a urologist.
Was it just for a checkup? What brought you there, Peter?
Kim, you're asking the wrong person questions.
Yeah.
I went because I was curious about getting a vasectomy. And so it was a consult. So I didn't even drop my pants.
And neither did I.
In that way, it was quite a comfortable, positive experience.
Yeah. So is it most men just walk in there for a consultation and don't ever come back, or they don't go through with the procedure? Or?
I don't know the numbers on that. I think it honestly depends on why they're thinking about getting a vasectomy. Because a lot of guys are sort of coerced in there by their wives. Those guys end up showing up again because the wives sort of have the power when it comes to that. And some guys start to feel guilty that their wives have gone through so much in terms of birth control and having babies and all that. They're like, all right, my turn to step up to the plate. Yes, there's a large percentage of guys who don't end up scheduling vasectomies. There's guys who I'll consult and then like a year later, they'll go, oh, you know what? I need to schedule that. And my nurse will come to me and go, oh, do you need to talk to him again? Or can we just schedule this? So I don't know the exact breakdown, but my sense is that most guys who come talk to me end up getting a vasectomy.
Let's hold off on the vasectomy stuff just for a few moments, only because I think we can go pretty deep on that. And I think it's important for obviously the topic of the podcast. Okay. So you're a doctor who specializes in the urinary tract.
Yes.
For men or women. Okay. And so what does that mean exactly? So like, what can go wrong with the urinary tract?
Well, I mean, it's anything from the kidneys to the bladder to the prostate and then sexual function. So,
Okay.
I mean, I see lots of folks who just come to see me for a kidney stone. I mean, nothing to do with, true sexual stuff or urinary stuff, but just have a stone. My niche while my practice was in Connecticut, I did a lot of prostate cancer work. And so I still think that most of what a urologist does relates to the prostate.
Okay. Will my prostate kill me or try to kill me?
Not likely, but it's possible. I mean, prostate cancer is the number 2 cancer in all men.
Okay.
Behind skin cancer. And in the news, if you read it, they talk about it just not being a very significant cancer, being slow growing, but it's still the number 2 killer of men with cancer behind lung cancer. So, I mean, it is a potentially significant cancer.
It's my understanding of it is that if you live long enough as a man, you're likely to have an issue with your prostate.
Well, certainly you're going to have an issue with your prostate. Yeah. I mean, if you want me to go deep into prostate cancer studies, there was a crazy I'll be quick about it. There was a crazy study where a guy looked at a pathologist, not just a guy, but a pathologist,
some dude on Reddit,
looked at men who died from car accidents, shootings, stabbings, and took out their prostate and looked for cancer cells. And by decade, that was sort of the percentage chance of you having some prostate cancer cells. So a 70-year-old man had a 70% chance of having some prostate cancer cells. Now, we don't diagnose that in 70% of men. So they're probably inert cells that don't go on to cause true disease, but it's pretty terrifying the amount that's actually there.
I see. So what exactly is a prostate?
I don't know. No. The prostate is a gland that lives underneath the bladder. The urethra, the urinary tube, runs right through the middle of it. And that's why it causes so many problems for men as they get older. The prostate gets bigger, compresses the urethra, urine has to go through there. And so that's the urinary issues. The function of the prostate is to provide nutrition to sperm. So once you're done making babies, the prostate doesn't do anything but get in the way.
Oh, okay. So I have a checkup coming up. So I do a yearly checkup with the doctor here in town, Siegfried. Jill Siegfried. I'm sure you've met her. So she's been my, as far as doctors go, it's the longest I've had since like my childhood doctor, Dr. Ringgold. He's not around anymore, but he used to smoke in the office. That's how old I am. So I remember when I was turning 45, I went into my checkup, and so she comes in and I say, "Hey doc, I'm 45. Are you doing something special for this checkup?" And she's like what, for example? I go, "Well," and I point at this tray that's next to the table that I'm sitting on, and there's a rubber glove and this beat up bottle of lubricant. It's been used a lot, kind of a thing. It's all crinkled and all this kind of stuff. And she goes, "Oh, no. I think she said that's 50. I can't remember exactly, but it's not now." And she puts it away. And I said, you might want to send the nurse in here again and do my blood pressure reading again. Because I think it just improved. I think it might be a little bit high. And she looked at the chart. She goes, "Oh, yeah, it is. I think we will do that." So this prostate can go haywire, right? And it's more likely to the older you get. Right. And so there's a lot of new literature about checking this. Yeah, well, I mean, and a lot of it has been negative. I mean, the United States Department of Human and Health Services, whatever. Awareness. No, I mean, they came out a few years ago and said screening for prostate cancer was a mistake and actually could cause more harm than good, which the urologic community was not happy with that report. And if you actually read the report, one of the risks that they include in getting your prostate screened, which included the exam you were referring to, plus a blood test, was that you potentially could end up with a bruise from having your blood drawn. Okay. So I mean, that kind of destroyed it. Where are they taking the blood from? I thought you were going to have a question about how are they checking this thing. Yeah. I have a lot of questions about this. Please, that's why you're here. Oh, I actually don't have a question. Oh, well, I can just say, I mean, the official recommendation is 50 if you don't have a family history, but 40 if you do. And I was actually 43 when my father was diagnosed with prostate cancer, and I was sitting in the waiting room while he was having the surgery, being on the
other side of the doors,
I see.
And I went, oh my God, I just went from not needing my prostate checked for 7 years to
tomorrow.
I'm 3 years too late. Like I should have been doing this.
This is a hack joke, but I'm going to ask it anyways. As a urologist, can you check your own prostate?
I've not tried, but I have been doing yoga, so it might be more possible than it used to be, but I have not tried. I went for my checkup and the practitioner looked at me and asked me, like, do you do it? Do you have one of your partners do it? And I'm like, no, dude, you're doing it. like, sorry, you can't get out of this.
So for those of us who have not had this checkup,
yes.
Can I ask what it
it's
entails?
Still much simpler than what you do. It's just a rectal exam.
Okay.
It's take a feel of the prostate. That's
okay.
it.
And you're looking for a bump or
feeling lumps or bumps. Yeah.
Okay.
Yeah. And it takes all of 5 seconds to do. And guys make a much bigger deal about it than it actually is.
Yeah.
Okay.
I'll let you know next year.
Okay. Yeah.
So kidney stones, that's what you started with. So that's common.
Yes.
And that's what I've been lucky enough to avoid having a kidney stone. I drink lots of water. Does that help?
That absolutely helps. And honestly, it's one of the things that moving to Colorado, I've noticed that people here, their stones are much bigger than what I'm used to. I have no idea what that is. And I kind of look at this community as a pretty good water drinker.
But they're probably you're just more dehydrated.
I guess so. I mean, yeah, because everybody's exercising nonstop.
Yeah, it's low. For people who don't know Boulder, we're a mile high basically, and then it's very dry. So maybe humidity in the summer will be 10%, 15%. And so you get dried out really.
Right. Well, yeah, no, I'm seeing a lot of kidney stones, but
big ones.
Big stones.
Okay.
So what exactly is a kidney stone?
It's exactly what it sounds like. It's a little rock that forms in the kidney. And if it's sitting in the kidney, it doesn't really cause problems other than occasional blood in the urine or something like that. But if it tries to move and it goes between the kidney and the bladder, it can get stuck and cause significant pain.
Are men or women more at risk?
Yes. No, I don't know.
Okay.
No. It's about equivalent.
I see. Okay.
Yeah.
Do you treat it differently for men or women?
No, it's exactly the same. I mean, the only thing that would be different is if it's a young woman of childbearing age. We try not to do the shockwave treatment that could have potentially affect their ovaries. But outside of that, it's exactly the same.
I see. And so you basically break these things up with
sound? All kinds. No, this is why it was great that I played video games as a kid. I mean, we have lasers that I get to break stones up with. We have ultrasonic waves. I mean, it's video game.
Huh. Oh, as an aside, is this a concern that eventually robots will do that job? Is that the kind of medical? You know how like robots can read X-rays now and stuff like that. Is that coming?
Not that I'm aware of.
Okay.
I mean, we do robotic surgery and patients sometimes get confused that robots are doing the surgery, but it actually is just a tool that we're using. So, I mean, I guess, you can go through a scanner and you could be found to have a stone, but I mean, you still have to have the consultation with the patient about how to treat that stone. And
I see.
So,
well, yeah, I was just imagining, you're just like, oh, you're just going to have this machine do this thing for you at some point in life.
After the machine does the prostate exam, right?
Okay. So kidney stones, prostate cancer, and other prostate issues. There's other issues besides cancer.
Yeah.
And that involves, obviously treating it and then removal sometimes.
Correct.
Okay. What are some other things before we get to the juicy stuff?
Yeah. Well,
you do something called brachytherapy.
Yeah. That's just a different treatment for prostate cancer.
Okay.
That's just radioactive seed implantation. So no, I mean,
that's just,
well, I mean, I don't know. It's not that exciting to talk about. We see a lot of women with bladder dysfunction, just, the urinary frequency and racing to the bathroom and leaking with coughing, sneezing, and laughing. And then the other main thing we do is erectile dysfunction. I do a lot of treatment of Peyronie's disease, which is curvature of the penis with erections.
Oh, we need to talk about that.
Yeah.
That's like a disease?
Well, that's actually what I say to patients. I hate the word disease in that because when you say the word disease, it makes it sound like it's something you caught. It's something you're going to give. It's, all it is a scar formation in the erectile tissue.
So you can correct that?
I can, yes.
Oh. Are you going to make some calls?
There's so many guys out there who I think have no idea that this is like
there's a medication out that's starting to advertise. And a lot of like the old time docs didn't like the direct to consumer advertising of medication. But I actually think it's great in terms of letting patients learn exactly like what's out there. And I can't imagine there's many guys who have curvature of their penis with erection that go up to another guy and go, hey man, mine's curved. Is yours straight? Because I think something's wrong.
Yeah,
I just don't think that's a conversation that guys want to have.
Peeking over in the locker room.
Well, yeah, I mean, also I think I can tell you there's not many erections in the locker room, Kim. Okay, so there's scar tissue that's sort of just...
Right. So the erectile tissue is just a sponge that gets filled with blood. And that's what causes it to get wider, longer, and harder. And so if you have a scar on one side and that side can't expand, then it's just going to curve towards that side.
I see. And who's Peroni?
That's an excellent question. I think he was the protege of Leonardo da Vinci.
We were talking about the Leonardo da Vinci exhibit down in Denver prior to this. So that's a serious inside joke.
Yeah.
Is that the person who...
I'm sure it is. I mean...
I'm sure this was on an exam of yours a long time ago.
A long time ago, but... Yeah, probably not the first patient. That would be awful to be the patient to have the disease named for you.
That's like Lou Gehrig's disease of penises.
Yeah.
Okay, and you treat that?
That's actually a medication that's injected directly into the scar to try to break the scar down.
I see. Okay. And what's the percentage of men in the population who have this issue?
Well, I mean, back to what you guys were saying. I mean, a lot of guys don't.
Kim,
don't
wait, hold on. Hey, Stephen, for a second. Kim, what is the percentage of men in the?
I mean, definitely a couple came to mind.
But if you're doing percentages, that's a couple out of
some amount.
I mean,
more than 2 and less than 100.
Yeah.
Yes.
No, but because guys don't talk about it, we probably don't know the real answer. I mean, it's estimated to be, somewhere between like 8 and 12%. But
wow.
Yeah.
Okay.
So, but it's also how curved is curved.
Yes. Right. Is there a percentage that then counts?
Well, in order to get a guy qualified for this medication, I actually have to give a guy an injection in the office to give him an erection, and then measure with like a little protractor kind of thing to measure the degree of curvature.
Oh, that must become a comfortable interaction. Yeah. Do you use a drape? Like, does he not see what you're doing, or does he just?
No.
Okay, I don't know.
Yeah.
I'm asking for a friend. What do you inject into a penis to give it an erection?
Well, there's medication that will do exactly what happens physiologically to create the erection. I mean, it dilates the arteries to bring more blood in there. It constricts the veins to trap the blood there.
Okay. And who was the person who invented that?
There actually is. There's actually a great story. I don't know his name, but at a American Urologic Association meeting, the story goes, I mean, this is back before I was in practice, that he injected himself.
Okay.
And got an erection in this meeting and walked up and down the aisles to show the urologist his erection that he created with this injection. And folklore has it that the urologists were reaching out and sort of pinching it to feel how firm it actually got.
I think you couldn't get away with that today.
I don't know. The urologists are a pretty interesting group.
Yeah. Okay. Let's digress for a moment. I know Kim has her vasectomy questions in front of her. What is a urology conference like? Is it like a big party scene? Like, are urologists kind of more outgoing, extroverted, comfortable types of doctors?
I think urologists do have I think there's a general belief that urologists are sort of the nice guy surgeons. So, I mean, it's
no God complexes in the urology world.
No, I don't think that really goes on.
Okay. All right. So they're fun, but they're nice and fun. Or they're just nice.
Yeah. They're meant to be educational.
You're talking about yourself.
I know.
I'm making you.
No.
Why urology for you? What was the draw there?
That's a great question. I knew I wanted to be a surgeon, and so I wanted to go that route. I just looked at different fields, and I liked the variety of ailments that we treat. I liked having the longevity of having a patient with me, and not just like, all right, you have appendicitis, you need your appendix out. I took your appendix out. Now I never need to see you again. But so I get to follow these patients. I get to treat cancers that are curable. So I don't have to have a lot of really bad conversations. And there's fewer emergencies. So I get some
9 to 5,
better
Monday through Friday.
Well, it's not that good, but it's not bad either. But yeah, I get to sleep.
What are what emergencies do you see?
Kidney stones are the most common, late night calls in a lot of pain, but but those can usually be treated with pain medication overnight. They're not usually, urgent surgery, but the only true emergency I take care of is testicular torsion, where the testicle twists, and you got about 6 hours to untwist it, or the guy could lose the testicle.
And how does he twist it up?
It just one of those things that just kind of happens. I mean, it's not like it's a sports injury. It just, the testicle is really a ball on a string. I mean, and the cord has the blood supply, and if the testicle twists, it just twists the blood supply and cuts it off.
I assume once it's been twisted.
The patient knows it hurts. I mean, there's no. I mean, it's not difficult to make that diagnosis.
And does that happen most of the time, like just walking down the street, or are they like having an erection?
Are you doing gymnastics?
Yeah. Like what's going on where this happened?
There supposedly is an increased incidence with masturbation, but I don't think guys normally admit to that. I think they say it just happened.
I played lacrosse for 25 years. And I played defense, and so I religiously wore a cup, like a athletic protector, supporter and protector. And because people are often shooting the ball at high velocity at the goal, and sometimes you're in front of the goal, and you'd rather the ball hit you than score, right, kind of thing. And so I've been hit on square on the cup before, and had some swelling, I'll say. I didn't have I was getting twisting, but I had some swelling, and it was really bad. It was one of I didn't go to a doctor because I didn't think there was anything to, everything was intact.
Yeah. Unless you ruptured the testicle. Yeah. I mean, there's nothing to do. I mean, it just hurts.
Yeah. It just hurts.
Yeah.
I don't know why I felt like I needed to share that, but that's so, okay. So we're going to get to some of the good stuff, but so kidney stones, prostate cancer, incontinence. What typically causes incontinence?
Well, in women, it's usually having babies. Okay. And having hysterectomies and changes in hormones as they get older. And
is that because of muscular, sphincter type stuff?
Not necessarily sphincter. That's less common, but just the pelvic floor gets weakened. Okay. And so so the bladder doesn't have the same support it once had.
So I have a question about the pelvic floor. So recently, coming into my mid-30s, I keep hearing everyone talking about these yoni eggs. Are you in weights and stuff? Is this not inappropriate?
No, of course it's appropriate. Okay. I don't know what they are.
So it's like a weight that you insert into your vagina, and you're supposed to just go about your morning routine trying to hold onto it. Like you brush your teeth, you drink your coffee, you walk around your house, and it's to keep the muscles you're supposed to try.
It's a vaginal workout.
Yes. Okay. So that's supposed to help with future bladder issues, especially in women who have had babies, is what I've heard.
And how big is this thing, and how much does it weigh, and what shape is it?
So I guess I'm not an expert. I don't have one. I've been searching for one. But they're, about the size smaller than my chapstick. And I think they're made of different things like jade, rose quartz. I'm sure there's non-crystal ones for the non-boulder people.
For the non-hippies.
Yeah, I'm sure you can get one made of metal. But I was actually in Pharmaca yesterday, and I saw some of them there.
How's it spelled?
I think it's YONI. But they're just vaginal weights. And I think there's also different heavinesses that you can use.
Okay. Is this a real thing, or is this snake oil?
That one goes beyond me. I've never prescribed those, but I mean, it does make some sense if you're trying to work a muscle out. I mean, there is a pelvic girdle of muscles. And so certainly if you're contracting those and keeping them strong, that's going to be helpful.
All
right. Well, good to know.
I didn't know that there were
rose
quartz ones. Yeah, would be better than the stainless steel.
There are, yeah.
And as you get stronger, do you start to up the weight?
I think that's what happens. Yeah, I think that's what's supposed to happen.
All right.
Is
the newest Olympic sport.
I know. Now you can prescribe vaginal weightlifting to your patients.
I could just see, like, you know, people in Boulder are like super competitive when it comes to their fitness type stuff. I could just be like, you know, you're like, I'm at 3 kilos now, kind of a thing.
I have no idea.
Okay. So what are some other, so again, you said from the kidney to
all the way down. So I think we're down. I mean, I talked to a lot of guys about erectile dysfunction.
Okay. So yeah, let's chat about that because in your opinion, what percentage of like erectile dysfunction is actually physical, physiological versus psychological, emotional?
Another great question, because it used to be believed that it was all in the guy's head. And so now that thinking has turned around completely. I mean, and thought to be pretty much always physical. Although I would argue that whether it's physical or not, it ends up being psychological because a guy wants to perform and perform well. And so if he's having a little physical issue, and it's affecting him, and you know, and it's an important date, and the guy's like, all right, this time I gotta have a good erection that they can talk.
It's on the to-do list. It's shave, shower, right?
And it's probably at that point that the guy is starting to think about it and worry about it and go, God, I hope tonight, like I perform well. Mm-hmm. So, you know, certainly it's a physical issue. It's a loss of blood flow to the penis. I mean, in order to get an erection, you have to increase the blood flow to the penis 6-fold. There's no other part of your body that needs that kind of increase in blood flow. Okay. So if you have a little bit of disease, it's going to show up in the penis first. But those guys are all in their head.
So the penis is like the thermometer of the body.
Well, there's actually belief, you know, you hear about the guys.
I got a smile out of Kim for that one.
There's actually belief, you know, you have the guys that are in an amazing physical shape that sort of, you know, drop dead of a heart attack. And there's a belief that, you know, well, maybe they had, you know, heart disease that just went undetected. And maybe guys that are younger that have erectile dysfunction are showing the first signs. And so that maybe a guy like that should have a cardiac workup to make sure there's nothing going on in the heart, because they're too young to be having erectile dysfunction.
Yeah. And so, okay. So that, you know, the psychological part of it, the physical part of it is, you know, you think about as men get older, this is more likely to happen. And so that would be suggestive that it's not psychological, that it's physiological or physical in some way. And so you're saying it's mostly like there's something impeding that blood flow.
Right. Right. I mean, you know, your cholesterol's high and it's blocking some of the blood vessels.
Okay.
But I think one of my more interesting jobs as a urologist, I mean, I do become a psychologist for guys. And so I do see young guys with erectile dysfunction. And a lot of the times it's guys who are, you know, recently single, you know, then getting into a new relationship or they're out in the dating scene and they're dating a lot of different women and they want to be able to perform well as the, you know, the real masculine way of impressing a woman. Right. Mm-hmm. So, I mean, those guys will come into me and say, you know, you have a 24-year-old who says he can't get an erection. And, you know, you get down into it and you're like, well, I had been dating this girl for a while. We broke up and now, and so you start talking about it.
With a new partner and it's
right. Yeah. And it's one of the things the guys have in their heads that they need to impress somebody. You know, usually if you're in a long-term relationship and you're having troubles with erections, you can actually talk with your partner. Uh-huh. But if you're, you know, just meeting someone on an app, you probably just want to be able to perform and not have to have that conversation.
You know, I had, disclosure alert. I remember having, this is a long time ago. I think I was in my 30s. I had a very serious relationship. Like, it was someone I thought I was going to marry. This is back when I thought I would get married. And, I didn't think I was going, my goal wasn't to get married, but with this person, I thought that would happen. Right. So I wasn't seeking it out, but I sort of stumbled on it. And the relationship ended in like spectacular fashion. And I remember the first time I was with a new partner after that, and had exactly that experience, in part because that was sort of like the moment in time where I was like, this is really over, right? This is clearly done. And so it was all in my head. Fortunately, I had known the woman prior to that for a while. And I just was like, sorry, I just freaked out a little bit here, kind of a thing. And she was understanding and quite compassionate about that experience. So yeah, I could see how that side of it would, can mess with you. Right. When there's really nothing physically, I was in my early 30s at that time. But what about like fatigue, alcohol, right? Like there's sort of,
all of those will play a role.
Okay.
Yeah, for sure.
So what is the course of action for dealing with erectile dysfunction?
If you're facing
Yes.
whiskey dick, what do you do?
I think you sleep it off and try again tomorrow. I'm sorry, what was the question?
So somebody comes into your office and they're having trouble performing with their new partner or their partner for a long time. What do you do? Is there medication? Do you refer them to someone?
Well, I am that someone. So,
okay.
So they've been referred to me. So,
well, I meant a mental health professional.
Well, most guys are having a hard time going to a urologist, and they sort of don't want to talk to a psychologist about it. But I mean, most of the time, if they can talk to me about it, and I can just tell them they're actually okay and things, that's pretty normal, and that I've heard this, 1,000 times before. I think that helps some guys. But I also use, Viagra, Cialis, Levitra, all the erectile dysfunction drugs. They've started to go generic, and they've come out in really low doses. So you can tell a guy, listen, it's okay to use a crutch for a little while, and let's get you some confidence and get out of your head. And, if it's an important date, and, then here's some medication that's going to help you, and it's going to work because there's nothing wrong with you physically. Mm-hmm. Yeah, the crazy thing about erectile dysfunction is even if I work up that guy and find something physically wrong with him, the treatment's the same. It's still just try these medications and see if it works. So I'll tell a guy just to try a low dose, and usually they're happy and they don't come back.
So even if it's just a placebo effect, right, and just gets them over that hump, so to speak. So is there, that was not meant to be a joke. I was thinking as you guys were talking, I usually make jokes and I'm, kind of cheeky in general, but you start talking about dick stuff and it just
becomes less funny.
No, it just becomes more, there's just more opportunity. Like there's a reason, that the dick joke is so popular in hack comedy. But okay, so you say the treatment is the same, but are there, what about just general health, right? So let's suppose you're having some of these issues. Shouldn't the guy start eating better, exercising more, taking better care of himself? Well, can that potentially have an effect?
If the guy if it seems more physical, then yeah, absolutely. I'd get him back to their, regular family doctor. And those are the guys I was mentioning before that may benefit from having some sort of cardiac workup. Just to make sure that there's nothing more significant going on. If you're having trouble getting an erection, there's plenty of stuff that we can do as urologists to get you an erection. But you're right. Their overall health is more important. And, there's lots of reasons to eat well and exercise well.
I think you could use that as a tagline for your.
I was just thinking that.
There's many ways we can help you get an erection.
Yeah.
Call in now. So schedule an appointment.
Or everyone leaves here with an erection. Yeah.
Okay, but there's a difference, of course, between erectile dysfunction and sex drive.
Correct.
And so you also do work with men who are low
deficient in testosterone. Yeah.
Do you do anything with guys who are too high?
There's not a whole lot you can do about that.
Okay.
So no, but that when I was talking before about consumer to consumer marketing from these drug companies, when all of a sudden there were all these medications that came out for testosterone replacement, we started checking testosterone like never before. When I first got into practice, we really weren't checking that many guys' testosterone, and then it got in the forefront of everyone's brain, and so I'm checking a lot of testosterone these days.
Yeah, I think. Okay, disclosure alert. I once, so actually with Dr. Siegfried, was doing the annual checkup and everything, and she asked questions about your sex life and protection and this and that and all those kinds of things. And I was saying that I had been kind of less, let's say, amorous than I normally would be. And I had a partner at the time. And I was like, is there Like, is there something wrong with me? Is this normal? What's happening? And if she said, what do you think it is? My answer was stress. Like, I'm just really stressed out. And when I get stressed out, like, that's seems to be an outcome of that. And she said, well, let's just check your testosterone just in case, kind of a thing. And around the same time, I have a colleague. He's in Australia, but he was a professor during my PhD. He does research on testosterone and its effect on things like risk taking and all this kind of stuff. And so they do a very simple test of testosterone, which is, it's like the digit difference. So it's like the difference between your, index finger and middle finger, something like that. And it's an indicator evidently of like prenatal testosterone, which is correlated with testosterone in general, but it's a very weak test. But nonetheless, you can still detect differences. And so I'm on the phone with him and I'm like, oh, it looks like mine's pretty. He interrupts. He goes, Pete, you have high testosterone. He's like, I know it. Just like from knowing you for 15 years kind of a thing. And so my doctor, she comes back and she's like flipping through the chart and she goes, well, it's not your testosterone. But yeah, I had never had it checked. And she, and so it's obviously like as a guy, I think it's an interesting test because this idea of testosterone, masculinity, manhood, all these things, like rarely as a man do you have a number that you can put next to how much of a man you are. And it seems like testosterone is sort of that number.
Yeah, I mean, and there are guys who are hoping it's low so that we'll give them testosterone.
I thought there'd be like guys who are in the north. They're like, you're average. And they're like, shit. Do you get that too?
Or I mean, there's actually a big range of what's considered normal on these blood tests. And guys are a little competitive with themselves about how normal they are. Like, well, it's in the normal range, but shouldn't it be higher? Like, But higher's
not, my understanding of testosterone is higher is not necessarily better.
Correct.
There's sort of a sweet spot.
Right. Once the receptors are filled, I mean, then the rest of the testosterone is just floating around doing nothing.
I see.
So can you gauge, if you see two guys walking down the street, can you gauge like physical characteristics to figure out which one has higher testosterone?
Besides their digit.
No.
Yeah, no, you can't.
But behaviorally, I think you can. I mean, again, it's a weak predictor, but things like competitiveness and stuff like that can be, no?
Right. Well, I mean, there's certainly, and
this is also in women because women have testosterone also.
Right. But yeah, so I mean, they're the guys that are more aggressive. I mean, the guys who live in gyms and work out and gauge their masculinity by how big their bicep is. Mm-hmm. I think those are the guys who are more interested in getting their testosterone to the highest amount. I mean, I've seen some of these guys who've come to me, wanting testosterone whose, muscles are so big that they can't turn their head. Mm-hmm. And, the guy, swears up and down he's not getting testosterone from, the locker room in the gym. And you check their levels and it's, literally,
what is the rate? How is testosterone measured?
So the normal range is like 280 to 800. Okay. And one of these guys that I'm thinking of in particular, his level is like 12,000. And what? Yeah. And I confronted him with that. And he said, Doc, I swear I'm not using anything. And I said, all right, well, whatever you're not using, you need to stop.
Yeah. 280 to 800 seems like a wide range.
But once it's over 400, you're probably done. Like there's no difference between having a testosterone of 550 and 750.
Oh, that's interesting. So it's like the diminishing marginal returns, utility kind of thing. So the jump between 280 to 400 is huge, but between, and what are the benefits of testosterone for a man?
Well, it's supposed to be good for strength. It's supposed to be good for the heart. It's supposed to be good to get rid of belly fat. It's supposed to be good for energy level, for sexual desire. It's good for the brain. I mean, so having a normal testosterone is good. Is that the case for
women too? Do women get the same benefit? Because women have much less testosterone.
I would think it'd be different for women. But you should have a normal testosterone, but you don't want to have a super normal testosterone. And the problem is once you start using testosterone, the body stops making it on its own because it's going, look, you're getting it from somewhere else. We don't need to do this anymore.
Is this an injection?
Well, there are injections. There are no pills. There's injections, but a lot of guys are using gels. I mean, if you remember Barry Bonds and the clear gel.
Oh, yeah.
There you go. I mean,
okay. And so.
And it's also, it was used by the bicycle racers because it also, one of its side effects is it increases the red blood cell count. The red blood cells carry oxygen.
Okay.
So if you have more red blood cells around, then you have more oxygen in your bloodstream so you can compete better. And that's why testosterone is an illegal drug for cyclists. I mean, Barry Bonds wanted it so he could hit more home runs and be stronger, but cyclists want it so they can go further faster.
I see. And what about naturally trying to enhance or improve like people have talked about like lifting heavy weights and things like that as a way to help stimulate testosterone. Is that?
I don't think you're going to, you may be able to increase it a little bit, but you're not going to take a guy who needs testosterone replacement and fix that.
I see. Okay. That's interesting. Yeah. Cause I've heard like people talk about like deadlifting and now is there also like a state versus trait element to testosterone? Like does it increase and decrease through the course of a day or through the course of a week or a month?
No, there's definitely a cycle to testosterone.
Okay.
So yeah, it definitely moves up and down throughout the day. In fact, if you're going to get your blood drawn, you have to do it before 10 o'clock in the morning for it to be an accurate result.
I see. Huh. Kim is just.
I'm just like, I'm learning so much right now. That's what I was just thinking. I'm like, I know all about erectile dysfunction and testosterone. This is great.
Well, this is obviously the point of the podcast is like to tackle topics that people don't normally talk about and that you might not even anticipate that you need to know at some point. Of course, the goal of this is designed for single people,
right?
And even more than just for single people, but to try to help them live in a better life. And so some of the topics are very clearly geared towards the opportunities that single people have and so on. So what gave me what brought me to you and what gave me the idea to do this and what gave me the idea to invite Kim is the notion of having a vasectomy. Right. So if you decide you're going to be single, you don't want to have children, as a man, why wouldn't a vasectomy be on the table, so to speak? Obviously, but what's interesting is most of your patients are folks who are married.
Right.
Right. And we actually talked a little bit about this.
And also guys who've just gotten a divorce and they're going to go out and start dating again and they don't want to, have an accidental pregnancy.
And those guys would fit, this sort of solo life, right? So divorced men, you're single and so on. So if you were to break those percentages down, the percentage of guys never married, don't want to have kids, guys who are married have had kids, but don't want more, divorced guys.
I think it's heavily biased towards married men who've had children. So that's probably 80% of the guys that I see. But and then there's some guys who are married that just choose not to have children. Mm-hmm. And then the rest are the single guys who just said, listen, and a lot of them have reached that age where they go, even if I decide that now is a time that I'm going to stop being single and I'm, going to find a life partner. Mm-hmm. I'm at the age now where I don't want kids. So,
what age is that usually? Just curious.
It's different for different guys, but, certainly once a guy gets into their early to mid 40s, they start, thinking, mortality and like doing the math in their head of like, how old will I be when the kid graduates from high school if I had one tomorrow? And they go, you know what? I'm not doing that.
Yeah. Be 70 with a kid in college, right? That kind of stuff.
And then sometimes I get guys who come in that are, in their late 20s that want a vasectomy. And you're like, wow, that's pretty early. And then they go, well, I have 4 children. I'm like, all right. You can stop.
Very little ED in that guy's life. So maybe describe what the procedure is for a vasectomy.
The vasectomy is by far the simplest form of permanent birth control. No question. Easier than anything that can be done for or to a woman. But the vas deferens is the tube that goes from the testicle to the ejaculatory duct. Its only function is carrying sperm. So a vasectomy is cutting in some manner that tube. So to prevent sperm from getting into the ejaculate. And it's a simple procedure I do in my office. I happen to do the least invasive procedure that's called a no needle, no scalpel vasectomy. So guys who are not used to going to the doctor, like the idea that we're not going to use a needle to inject their scrotum. I actually have a spray gun that'll spray lidocaine through the skin to numb everything. And then we just make a small puncture to get to the tube. There's two of them, one from each side, but I manipulate the second one to the same puncture site. So you just have the one hole. And it really isn't that big of a deal. I mean, I tell guys I need to go home and pretend like it's a big deal so they get some sympathy, but it's really not that big of a deal. And
so you cut this and you basically cut a piece away.
I put little titanium clips onto the tube, and then I also remove a segment. So I occlude the tubes and then I separate them so they can't, because one of the long-term risks, theoretical in my mind, is that the tubes can grow back together. But the way I do it, I just don't think it's possible. I've done over 3,000 of these things. And as far as I know, it's never happened that it's grown back together.
Okay.
Are they reversible?
They are reversible. I have reversed them. The problem with the reversal is insurance usually doesn't cover that. And it's a really expensive procedure. So what takes me 10 or 15 minutes to do in my office takes me about 2.5 hours to do under a microscope in the operating room to sew the vas back together. And, I tell guys, think of it as a permanent thing. I mean, if you wait too long to try to reverse it, then the testicle does stop making functional sperm. And so even if you can reattach it, it's not going to, the likelihood of a pregnancy is quite low, and it's expensive.
How many consultations do you usually do before you schedule the appointment?
Oh, it's usually just one. Just one visit.
Okay.
I'm on number 9.
I'm like, you didn't make it back after that first one, did you?
So, and then you have to wait some period of time, and you have to then have your so you have to be checked,
right?
Sure
you're not immediately sterile once you've had a vasectomy.
You don't get home and be like, "Hey, honey."
Yeah. Well, you can, but that's where you say that you still need to use protection.
Yes.
But because there can be sperm on the far side of where we cut, you do need to have a bunch of ejaculates in order to try to clear out the tubing.
Okay.
So usually 4 to 6 weeks later, we get a patient to go for a semen analysis to make sure there's no sperm there.
I know someone who recently had it, and he was upset that he has to for some reason his wife can't use birth control right now.
Right.
And so he's like, wait, I have to use condoms with my wife for the next 6 weeks. And
what was he doing before that?
Well, I think that's what they were having to do. And so he thought he would be free and clear pretty quickly. Yeah. Kind of a thing.
So, are the guys in a lot of pain? I have so many questions about this. Are the guys in a lot of pain after the procedure?
They're sore. And, I used to provide pain medication, prescription for narcotics after this. Honestly, with the whole opioid scare in the news, most guys now don't want pain medication afterwards. And so most guys are going home and taking Tylenol and Motrin, and I never hear from them. I haven't gotten many calls about, hey, I'm in so much pain, I need pain medication. I mean, back to your story about lacrosse and getting hit in the balls with
this hard rubber ball. Yeah.
It's not the sensation of just getting hit. It's sort of that, 4 or 5 minutes later where it's still kind of sore, but
it aches.
But you can see again. Mm-hmm. That's sort of the sensation. But guys go home and put an ice bag or frozen peas and just sit on the couch, and they're usually okay.
Mm-hmm. And you can have an erection right away, or do you recommend taking some time off?
Well, having the erection and using it may be two different things. But yes, I tell guys to take a few days off from sex, and I tell them, you'll know when it's okay. I mean, when things aren't hurting, then, you can go back to doing it. But having an erection is not going to have any effect on what I just did.
So one of the things, when we were chatting, I thought one of the more fascinating things that you said, because I had asked, I don't know if you volunteered it or I asked, but the notion of, so, in the same way that women will freeze their eggs, right, so that they can get pregnant after they're it's not easy to get pregnant anymore. A guy might freeze his sperm and then have a vasectomy. And you said something that I thought was really interesting. Do you remember what it was?
What I probably would have said, what I've said to a lot of guys is that if you're thinking about doing that, then don't have the vasectomy.
Yes.
Because you need to think of this as a permanent event. Because there's a finite amount of sperm that you can freeze. It's expensive, although actually I did look it up for one patient. It's not as expensive as I thought to freeze sperm.
It's probably cheaper in Mexico.
I don't know.
Little vacation at the resort, go down, freeze some sperm. Yeah. Take a cruise down there.
But I think if you're at the mentality of that I need to freeze it, then you're not ready to make it a decision to do a permanent procedure.
Yeah, I actually think that that's a useful piece of advice. So if someone's like, they want to do it, but they're not sure. I mean, that's where I am. I sort of, maybe you can help with this idea is that so, I know I don't want to have children. And so it just seems like a no-brainer to do this. And yet I find myself reluctant to do it.
Well, there's all the what ifs, I mean, somebody might change your mind, right? And that's
yeah.
Well, but I think, maybe
for
not,
some people,
maybe not for you personally,
yes, right.
but I think there are people out there that go, yeah, but what if I meet this 25-year-old that the only way that she's going to be with me is if I at least have the ability, and that if I tell her I had a vasectomy, then, when you get right down to the basic biology of humans, the only function of man is to procreate, right? So once you've taken away that ability, you're kind of useless.
Yeah, that's what I say on my dating profiles.
Yeah.
Is there any correlation between like loss of erectile function and a vasectomy? Is that a risk?
No.
Are there any risks?
Two separate events altogether. There have been...
But there has to be a psychological risk, right? So if a guy believes that now he's less of a man, and because he, is that not a thing?
Honestly, I haven't heard that. Okay. I haven't had guys guys are a little concerned about it initially, but once I explain the anatomy, that like all we're doing is taking a tube that carries sperm and occluding it. That's it. Mm-hmm. So that tube has nothing to do with erections. So the only thing that changes sexually for a guy is there's less ejaculate. So because there's no sperm in it. But sperm only makes up about 10% of the fluid. So 90% still comes out. So most guys can't tell the difference between, that losing that 10% of fluid.
Does it come out with the same force? This is a major question. I feel like I brought this up to you maybe when you were thinking about it.
I'm so glad you're here because I would not have thought to ask.
Because I'm just wondering if it's like now a dripping, leaking faucet or if it's like seriously.
That should not be an issue. I think that's an issue for guys as they get older in general, but not the vasectomy part of it. So the actual emission comes from the squeezing of the prostate and the seminal vesicles. So that's further upstream.
Okay.
So all that's still good. Okay.
Just as a woman, that's an enjoyable, mom, cover your ears. That's an enjoyable part of sex is the force of the ejaculation. Okay.
This is why you're here.
Okay.
Thank you so much.
And now that we know about those crystals that you can insert.
You guys know a lot. You've learned a lot about me the last couple of days.
Oh, did you bring your gear? Let's just get it done.
Yeah,
what do you think?
I don't have anything with me, but I see a kitchen nearby, so there's probably something that we could do.
Does anyone ever walk into your office? Well, I guess you answered this already, where you're like, do not do this.
Oh, this is good because you talked about your old practice.
Well, it used to be that we had a consent form that we had to have. There was a spot for the partner, the spouse, to also sign. And we were getting consent from the wife. And
isn't that amazing?
Yeah,
that just never made sense to me. I'm like, he's a grown man. He can make his own decisions. And if he does it and she didn't want him to do, that's between the two of them, and they can have that conversation outside of my office. To me, a vasectomy is a medical procedure. And just like, if you went and got a tattoo, like you don't need your wife's permission. So yeah. I never understood that.
Wow. What year was this? Was this like 1970?
Yeah. I'm not that old.
Okay. I know.
This was back east.
Yeah. But I mean, we stopped doing that. I mean, that just never made sense. And I couldn't understand. I mean, getting someone to sign a consent form is just a legal document. And if a person of majority age makes a decision to have a medical procedure, I don't think, their spouse or their mother should be able to come in and say, no, you can't do it.
Yeah. Were there ever people you knew weren't telling their partners that they were getting this done?
Not for a vasectomy, but I had one guy who I did surgery to put in a penile prosthesis, like surgery to cause an erection. And he didn't want me to tell his wife. And that one I never understood. I'm like, isn't she going to find out at some point? Like, but I haven't had that problem for vasectomies.
So that's like for guys who have,
like Viagra doesn't work, and this is a medically implanted or surgically implanted,
and like it pumps up, right?
Yep.
Yeah, I see.
Like the old Reebok pump.
And but some guys have this because they've had like testicular cancer or something. Like there's some other like more profound physical reasons that you might get that done.
Well, these are guys who don't respond to the Viagras of the world. I mean, bad diabetics or something like that. I mean, if you're a 50-year-old guy and you've had juvenile diabetes, I mean, the likelihood of you having erectile dysfunction that doesn't respond to Viagra is pretty high.
I see.
And so those are those guys. I didn't mean to change this topic.
No, that's fine. That's interesting because it didn't come up. What other questions?
So I had one last question. Has there ever been an instance where there's a guy who comes into your office for maybe not a vasectomy initially, and you're like, this guy should not have kids. Like, it is my duty to stop this man from reproducing. Let me see if I can talk him into this.
I'll give you a discount.
Yeah.
I can't say that I've ever decided that I should play God and decide who should have children.
Kim, what's his name?
I know.
It's Robert.
I did. There were in my practice back in Connecticut. I did have the opportunity to take care of a lot of federal prisoners, and some of those guys that came in with sexual deviancy as their crime. Mm-hmm. Those guys, I contemplated wanting to do something, but no, I never actually
never said anything.
Yeah.
Okay. So first of all, thank you for doing this. This is super informative. There's a few other things that I want to do, and Kim, you should keep the questions coming because you're really warming up.
Okay. Yeah. Too bad this isn't a 4-hour podcast. I'd be on fire by the time it was done. I know.
So, look, this is a skill that takes some developing. So, okay, again, getting back to this idea of the single life, obviously we've been a little more focused on men than women. Well, let's say this. In general, what advice do you have for people, given your expertise in terms of preventative, medicine, so to speak, or just things that they should be aware of and thinking about? And is there anything in particular that you think is, important for the single person? I mean, it sounds like, as you're saying, is like the idea of a vasectomy is kind of a no-brainer because of its permanence. Right. If you know that you certainly don't want that, but beyond those. Yeah, well, no, I think when it comes to single folks, to me, it really comes down to the sexual conversations that I have with guys. So I think that having the capability of going to a physician if you're having some issues and you're not performing the way that you think you should, it's not a sign of weakness. I mean, there's a lot of guys out there. And, if you think back about the original like Viagra kind of commercials, when they first started, they had Bob Dole as their spokesman. They had some old dude around. Yes.
And now if you look at the commercials, maybe it's just because I'm getting older, but everyone seems to be, in their 40s and 50s. And the reason, that's done for a purpose. And it's because it has become more acceptable to talk about erectile dysfunction. And I think a lot of guys, this is how we started the conversation about, that guys are reluctant to go to the physician and they feel like they're going to tell me something that I've never heard before. And I can't remember the last time I had a patient actually tell me something I had never heard before because we hear it all and it's a safe environment to come talk to us about the problems they're having. And if it helps them be a more successful single, and have the confidence to be out there, it's easy to do. I mean, it's a conversation, and there's no horrible testing that we're going to do to you. It's really just a conversation.
Mm-hmm. So this actually brings up a couple. Well, so my first reaction to that is I actually think it is useful for both men and women to hear that when you have a new partner, things might not go smoothly. Right. That some level of comfort often enhances the experience. I think,
and the ability to talk to the partner that when you are struggling a little bit and when it's a brand new experience, you can't have that conversation because it's just the wrong time in the relationship. I mean, that's when guys struggle the most.
Yeah, I think that. And that's the same for women, right? That there's.
Well, the difference in women.
I'm like, I don't have sexual problems.
But I mean, it's less obvious when a woman,
they did study whether or not Viagra would be beneficial in women because, I mean, the clitoris is analogous to the penis in terms of it has that's where it came, that's the same anatomical start. So Viagra will increase the blood flow, but there's no, way of measuring a woman's sexual function, whereas a guy, they're erect or they're not. I mean, a guy can see it, the partner can see it and understand it. But with a woman, you don't know if increasing that blood flow is going to make a difference.
Yeah. I mean, you can measure, there are ways to measure orgasms, but so you'd have to do that study. I don't know if that study's been done.
Orgasm is something nobody understands. That happens somewhere else.
Well, yeah, you measure I know this because, I have an ex who is a sex scientist. So she does research on these kinds of things. And so, that's a longer story in terms of, but that you can measure orgasms, but you measure it basically with like a butt plug.
But you can't.
That has it basically measures the force of it.
Yes. Right. But probably no evidence that Viagra would benefit that.
I don't think there is evidence that it does. I mean, at least, and I think theoretically there's not evidence. Certainly there's not a theoretical reason to believe that it was. I don't know if it has, any case. Though the other thing I lost my train of thought in terms of, responding to what you were just saying. That's too bad. Okay. Here it is. This is for male or female. Is there something you should be looking for in a urologist?
In choosing the right urologist?
Yeah, like
I'm a big believer in just having complete comfort with that physician. Mm-hmm. And I think that whatever advice they give you, if you're comfortable with that physician, then you're going to be more accepting of that advice and be more able to follow that advice. And I think because, guys are reluctant to go to physicians, they may just want to, get in, get out and just, get something quick and never go back. But I mean, I certainly I've heard from patients that are willing to go to different doctors. I mean, I've heard lots of stories about things that you just shake your head that urologists have said to patients. And, so
you're seeking comfort, basically.
Yeah, I think it's just someone you feel like you can talk to. I mean, we're people, we have experiences, and I mean, if I can understand and relate to you, I think that the relationship, the doctor-patient relationship, is a better one.
Are most urologists men then? Would you say?
Most are. I mean, I think I just saw the numbers. I think it's like maybe 9% of urologists are women. I work with one other urologist, and she's a woman, and she's perfectly happy and able to take care of all the same things that I take care of, and does a great job.
She's busier than he is right now. No, I'm teasing. He just moved to Boulder.
I mean, just because you're right doesn't mean
I'm just kidding. That's just a joke. Okay, so before we wrap up, I want to ask you. So you're living the solo life right now. You're living like the bachelor life, and have been for quite some time.
About 3 months. Yeah.
3 months now, and you've been married and married again, and you have kids.
Yes.
And so, but you haven't been like single for a while.
No, I've had a great relationship with my wife we've been married for 5 years, and we were together for a couple of years prior to that. So
how is it? How are you enjoying
being single? Well,
yeah.
It's really not fair because I'm in Boulder and she's stuck in the winters of Connecticut.
Fair. Okay.
And she's packing up a house and taking care of kids and taking care of a dog. Okay. And I'm reading books and taking walks.
Yeah. You just read the Leonardo da Vinci bio, which is like 500 pages or something, right? Certainly she has it worse now than I do. I'm living,
although I'm solo and although she still has all of our stuff in Connecticut and that my house that we're going to be moving into is completely empty. Like I have a mattress and 4 bar stools and that's it. I can't complain because I still get to sort of do what I want to do. And a lot of my responsibilities have shrunk.
Yes.
Although I did laugh at myself when I moved into the house all excited and went to the grocery store and said, all right, I mean, I can really like do some shopping and fill some stuff up because we're going to be here forever. And, so I bought my cereal, my milk, and I was all excited. I'm like, I'm going to have a cereal before I go to work in the morning, and got my cereal out and my milk, and then realized I didn't have any bowls.
That's very funny. How very Seinfeld of you to have to be eating cereal.
Well, I can't cook very well, so I don't have any pots or pans, so I knew that eggs were out of the question.
So you're a musician. I thought it was cool when you sent me your bio. You do School of Rock.
I do School of Rock,
which I think is pretty cool.
And I will say, well, thank you. I play guitar, and it's just I love music and been going to concerts my whole life, and that actually is something that came out of my solo life, because I was going through a divorce and realized that I was going to have a lot of time alone. You know, that there were 50% of the time my children weren't going to be with me. Mm-hmm. And I thought, that this is a time where I need to find a good, healthy hobby, because that's a good time for a guy who has too much time on his hands to pick up bad habits.
Certainly.
So, so I started playing guitar and my wife has become like our biggest groupie, and it's tons of fun. So yeah, I get to play in bars and be the rock star that I always imagined I wanted to be.
Do you have a band?
Well, the School of Rock, we are a band.
Oh, I see. So you go out and perform in the
you'll be there. Oh no, you won't. You're leaving.
I'll be there. I'm coming. There. Yeah, let me know.
And you're free to throw things at me.
Kim, you strike me as I like live music type person.
Oh, I have such a thing for music. All my ex-boyfriends, musicians. I love them. I can't help it. I don't even really like music. I just give a guy a guitar. I don't care if he can play. Just hold a guitar.
There you go. Well, this is great. So we're going to wrap up now. I'm going to say thank you, but I am going to say this for the listener. I'm actually going to do a very brief, separate recording right after this. And I'm going to tell Kim and Steven the time that I was cast in a Cialis commercial.
Wow.
Okay. I'm overpromising a tiny bit, but it is a hell of a story, and we have just enough time to do it. So, and with that, I want to say, Kim, thank you very much for being the co-host. I would ask you to do it again if we have an opportunity.
Okay, thanks, Peter.
And Steven, obviously you have what it takes to be a great urologist. Not only that you're steady with your hands, but you're very easy to talk to, a very likable guy. And if I decide to have that vasectomy,
we'll broadcast it during your podcast.
Yeah, maybe we'll do a live podcast.
That would be amazing. Can I please commentate?
Really appreciate the time.
My pleasure.
Thank you.
Pleasure.
So now on to the bonus. So this will normally be behind the paywall, so to speak. You have to sign up for it, but giving it away for free right now. Hope you enjoy this story about my casting call for a Cialis commercial. Here we go. So we're back. We're doing a little bonus. So Kim and Steven are still here. And I had said that I have the Cialis story. So I've kind of given away a little bit of the punchline, but I want to describe this event because it is a crazy story for me. So, and feel free to interrupt with questions, you two. So a few summers ago, this is maybe at least I'd say 4 years ago, I was going to be in Los Angeles. I decided I was going to spend some of my summer in Los Angeles. So I was there for like 3.5 weeks. And I rented a Airbnb in Silver Lake, which is like the serious hipster part of town. And I was just, going about doing my normal, writing. I was working on papers and so on. But then I was kind of living a little more LA lifestyle. And I got invited to this alt comedy show. So on Wednesday nights for many years, the alt comedy show in Los Angeles was at this comic book store on Sunset. in Hollywood, in the Nerd Melt Theater. So it was in a little cramped theater in the back, but it was like a who's who of comics. And my very good friend, Shane Moss, who is appearing on this podcast at some point, was doing a show and he invited me to it. And I was like, yeah, I'm definitely coming. It's a Wednesday night. And I brought a date. So this was a woman I had been out with one time before, and we had coffee or met for a drink at happy hour or something like that. So go to the show. It's a great show. It's fun, because there's one of my good mates up there on stage performing. And after the show, we walked down the street to a pub called the Pikey. So again, on Sunset. And unlike living in Boulder, at 10:30 on a Wednesday night, we walk into this place and it's jam-packed. Normally, it's like tough to find a place open at 10:30 in Boulder. And so that's sort of exciting and fun. But on the other hand, there's three of us. We want to sit down and talk. So I say, hey, I'll get us drinks. So I go to the bar and there's an open seat at the bar. And so I stand at that open seat. I order the drinks and I look to my left and I look to my right. And there are two couples on either side of me. And I'm like, oh, wouldn't it be great if one of those couples just gets up and leaves? So I'm waiting. This guy directly to my right, a little bit older, is in deep conversation with this young woman. And at some point, he looks over his left shoulder at me and he does a double take. And he stops the conversation, turns around and says, excuse me, are you an actor? And I was like, no, man, I've got a face for radio. There's no way I'm an actor, but I'm very flattered. He goes, too bad. I'm casting a commercial tomorrow and you would be perfect for it. So I'm like, all right, I'll bite. What's the commercial for? And he says Cialis. So I start making boner jokes, right? I'm like, oh, it's terrible, but my penis works. Like I'll probably pitch a 10 in the middle of the commercial and all this stuff. And I swear he looks at me, he goes, okay, if you're not interested. And he turns back to his conversation. And I was like, hold on.
It's so not very LA of you to not be begging the guy for work.
I'm like, I'm definitely interested. So he gives me his card. He runs the casting agency. Like he owns the casting agency. It says it's down the street. We're going to be there from 10:30 to 1:45 or whatever. Just come by. So I take the card. I go back to my friend in the date. I'm like, you're never going to believe what just happened here. And so the next morning I wake up and I get out the card and I send him a text and say, this is Peter. And we met last night at the Pikey. Are you sure? He's like, yeah, absolutely. You should come by. And I was like, what, how do I dress for this? Like, is business casual okay? And he's like, yeah, that's fine. So I get a car. So now it's like late morning, by the time I get over, it's like 11 o'clock or 12 o'clock or something like that. And, I get a car, I go over there and I go into this nondescript building. There's a waiting room and it's just like in the movies. So first of all, they were doing 3 spots, one for a white audience, one for a black audience, and one for a Latin audience. And they were casting the white and black commercial that day. And, so it was a very multicultural group of people in the waiting room, people like anxiously looking at the notes, or fixing their makeup or, it's very quiet. And of course I'm in there just like, I start talking to people, so I just start conversing with these different actors and all this kind of stuff. And I couldn't help but tell them that, I got invited to do this kind of a thing. Right. So they pair you up. They paired me up with this woman. She was like Russian or Eastern European in some way, smelled like cigarettes. I remember that distinctly. And I was like, so, how are you feeling about this? And she just goes, oh, I really need this commercial. I was like, well, we're going to totally get it because I know the casting director. So we get called in and I walk. And so it's like a black box room. There's a person at a camera. There's a PA, a production assistant, and then there's him. And I just walk right up to him and, oh, it's good to see you again. Shake his hand and all this stuff. And so we do the scene, and the scene is, it's an auction, and we're bidding on a clawfoot tub, which
right.
So Stephen, why is that important?
Because that's sort of the trademark of Cialis. They have the tubs with the couple always in 2 separate tubs,
separate tubs holding hands or something, right?
Yeah, it is the most bizarre little trademark, but that's what Cialis does.
Yes. So we do it. So it's very few lines. It's all just acting, just looking happy. And it's like the desire is building through the scene. And so she's like stroking my arm and all this kind of stuff. And so we finish and I know that it went terribly bad. I'm not an actor. It just was terribly overacted. It was really bad. So I thank him. I leave and I'm just thinking, well, that was a fantastic experience. And so I'm about to leave, but I'm sort of lingering because I don't want it to be over. And one of the production assistants says, hey, we have an odd number of women. We need a guy to do it a second time. And before she even gets to second time, I'm like, I'll do it.
That's good.
So I'm thinking, well, now I know exactly what to expect. It's got to go better. So I get teamed up with another woman who I actually recognized from being an actor. She's been on shows and not famous, but you would probably recognize her. And so we go and do it again. And, I walk in, I'm like, hey guys, good to see you again. I'm all warmed up. Do it again. Equally terrible again. And then we leave. And so we walk out, we're out on Sunset and I just say, oh, it's very nice to meet you. I said, I have a confession to make. I'm not an actor. I'm not. I hope it doesn't hurt your chances at this commercial. And she goes, oh yeah, don't worry about it. She goes, but you should know if you get this commercial, it pays $40,000.
Wow.
I know. I was like, what? And she's like, this is a union job. So you could join the Screen Actors Guild. I'm a rep for the screen. And I'm like, you are very kind, but there's no way in hell I'm getting this commercial. And so we parted ways. I went home. And I spent the rest of the day telling this story, texting people, calling people, emailing. I spent the entire day on this thing. And I waited for the call and I waited for the call and it never came.
And you're still waiting.
I'm still waiting for the call.
Did you have any problem with the idea of being in a commercial that was about erectile dysfunction?
Not really. Maybe a tiny bit, but I thought the upside was way, way higher than the downside. Because I'm a marketing professor. And so I had this plan. There's a Harvard business case on Cialis that I don't teach, but I was like, I'll start teaching it. And then what I'll do is I'll say to my students, well, let's just look at a few commercials to see how Cialis is doing their branding. And then I would show my commercial. And I think that the students would go completely crazy. I think that they would love that so much. I would get the highest evaluations I've ever received, but that didn't happen.
Yeah.
If I had gotten the call, I would have done it. There's no doubt.
I think it would have been a mistake if you hadn't done it.
Yes, I think it would.
I'm just curious what everyone else in that room looked like. How do you
cast? How did I?
Well, I'm just what said, Peter, you look like you have erectile dysfunction. Yes. People will buy you in this commercial.
Well, I think what Stephen was talking about was that the commercials have become more aspirational. The women have become hotter, the men have become younger and fitter, and so the guys in the room and the women in the room were young. The first woman, I bet you was 38. And the second woman I did the scene with was maybe 44. Right? So they were pretty young. And of course, they looked fantastic.
Yeah, I think they're trying to normalize erectile dysfunction. So it's not a disease of old men. So you take someone like Peter, who's a fit, healthy guy, and you say he's taking it. He, the actor, is taking it.
Yes, thank you.
Then it's okay for me, the mid 40-year-old guy who's healthy, who thinks I'm, something's really wrong with me that I can't get an erection. So it makes it okay.
I also well, you guys can see this, but I started going gray pretty young. I was maybe 45 at the time. So I was pretty gray, but still kind of looked youthful in that sense, if that makes sense, kind of thing. So I just thought this would be a great story to add to the offerings. Well, thank you for listening to that. I wish people could have seen your faces as I was telling you parts of the story. All right, great. Thanks again. Cheers.
Thanks.
Thank you for listening to Solo, the single person's guide to a remarkable life. For more about our guests and show notes, go to petermcgraw.org. Please subscribe and share with your single friends.